8 warning signs of a heart attack you should never ignore. Did you know that a heart attack rarely occurs without warning? In reality, your body often sends signals weeks or even months in advance of a potential cardiac event. Each year, millions of people unexpectedly suffer heart attacks, unaware that their bodies were trying to alert them beforehand. Symptoms like unusual fatigue, brief chest discomfort, or an unexplained sense of anxiety may all be subtle but significant calls for help from your heart. The alarming reality is that up to 80% of heart attacks are preventable if the early signs are recognized and addressed in time. In this article, we'll uncover 8 critical warning signs that can appear as early as a month before a heart attack. Signs you should never ignore. While some may seem minor or unrelated, dismissing them could result in dire consequences. And the first sign? It's something many people overlook but could serve as a crucial alarm just before a heart attack occurs. Before diving in, feel free to share where you're reading this from and leave any questions in the comments. Also, don't forget to subscribe and turn on notifications to ensure you stay informed with life-saving health tips that might protect you or someone you care about. First, let's talk about sign number 1, indigestion or heartburn. Many people dismiss heartburn as a minor digestive issue caused by a heavy meal, spicy food, or excessive caffeine intake. But what if that burning sensation in your chest isn't coming from your stomach at all? What if it's your heart trying to alert you to something much more serious? Discomfort that feels like indigestion can sometimes be an early warning sign of a heart attack, especially in individuals who don't experience the classic symptom of intense, crushing chest pain. Complicating matters further, acid reflux and heart-related chest pain can feel remarkably similar. Both may cause a burning or pressing sensation in the chest and can occur after eating. However, while heartburn is triggered by stomach acid, heart-related discomfort arises when blood flow to the heart is restricted, depriving it of necessary oxygen. To make things even trickier, the body doesn't always clearly differentiate between these signals. The heart and stomach share nerve pathways, meaning that when the heart encounters a problem, the brain may misinterpret the distress as an upset stomach. This phenomenon is particularly common among women, diabetics, and older adults, whose symptoms during a heart attack tend to be subtler than the typical signs. So, how do you know when to be concerned? If your heartburn is accompanied by nausea, cold sweats, dizziness, or pain radiating to your jaw, arms, or back, it's time to pay attention. These could be indications that your heart is struggling. Ignoring them could have serious and potentially fatal consequences. 2. Unusual fatigue. Imagine waking up in the morning feeling more exhausted than when you went to bed, even after what seemed like a full night's sleep. Suddenly, everyday tasks, like carrying groceries or simply making it through your routine, start to feel incredibly difficult. You might chalk it up to stress, aging, or a hectic lifestyle, but what if that persistent fatigue is signaling something more serious? This type of exhaustion doesn't improve with rest. Instead, it lingers for days, sometimes weeks, and seems to worsen over time. Even simple activities, like taking a shower or making the bed, can leave you feeling completely drained. Many describe it as a sensation similar to having the flu, but without symptoms like fever or congestion. The link between extreme fatigue and heart health lies in the circulatory system. When the heart isn't pumping efficiently, blood flow to the muscles and brain decreases, leading to feelings of weakness, dizziness, and mental fog. In response, the body prioritizes sending blood to vital organs, which can make your arms and legs feel especially heavy or weak. The worse the blood circulation becomes, the more exhausted you feel, even without doing anything physically demanding. Interestingly, many heart attack survivors admit to experiencing unusual fatigue for weeks beforehand but dismissing it as minor or unrelated. Don't make that mistake. Your body has ways of warning you when something is wrong. Pay attention before it's too late. 3. Sleep disturbances. You lie in bed, exhausted yet restless, unable to sleep despite feeling calm. Night after night, you toss and turn, sometimes waking up gasping for air or jolting awake for no apparent reason. It's frustrating, and you might attribute it to stress, age, or a disrupted sleep cycle. However, sleep disturbances like difficulty falling asleep, waking frequently during the night, or feeling unrest even after spending a full night in bed can be early warning signs of heart trouble. Most people don't link poor sleep with heart disease, but the connection is significant. When the heart isn't functioning properly, the body struggles to regulate blood pressure and oxygen levels. 2 factors critical for restorative sleep. One particularly concerning issue is nocturnal hypoxia, a condition where oxygen levels drop during sleep. This often occurs due to reduced blood flow caused by narrowing arteries, which makes it harder for the heart to circulate oxygen efficiently. In response, the brain detects the problem and triggers micro-awakenings, brief moments of wakefulness you may not even remember, disrupting your sleep and leaving you fatigued the next day. Adding to the problem is the role of the autonomic nervous system, which oversees involuntary functions like heart rate and blood pressure. When the heart is under stress from blockages or an impending cardiac event, this system can become overactive at night, causing adrenaline spikes that prevent relaxation and deep sleep. This may explain sudden awakenings, vivid nightmares, or a racing heart that many experience in the weeks leading up to a heart attack. 4. Mild shortness of breath. You're walking up a flight of stairs, something you've done countless times before. But this time feels different. Halfway up, you suddenly find yourself winded, as though you've just finished a marathon. You pause for a moment, trying to catch your breath, but it doesn't come as easily as you'd expect. Maybe it's just fatigue, maybe you're not in the best shape, or perhaps it's something more serious. Mild shortness of breath is often overlooked as an early indicator of heart problems. While many associate breathing difficulties with lung-related issues, such as asthma or colds, the connection between the heart and lungs plays a crucial role. When the heart struggles to pump blood effectively, the lungs have to work harder to supply oxygen, often leading to unexpected breathlessness. The distinction between typical breathlessness and heart-related shortness of breath lies in its timing and context. Feeling out of breath after strenuous exercise is normal. However, if you find yourself gasping for air during routine tasks, like walking, climbing stairs, or even having a conversation, it could signal trouble. In some cases, breathlessness can occur even while resting or lying down, prompting you to sit upright in the middle of the night just to breathe more comfortably. This happens when fluid accumulates in the lungs due to the heart's reduced pumping efficiency, a condition known as pulmonary congestion. The danger with this symptom is that it often progresses gradually. At first, you might only notice slight shortness of breath during physical effort. Over time, however, it takes less and less activity to leave you winded. Many people dismiss these signs, attributing them to aging or a lack of fitness. But when breathlessness worsens without a clear cause, it's often a red flag for an underlying heart issue. 5. Pain or discomfort in the jaw or neck. Jaw or neck pain is often an overlooked indicator of a heart attack. While many people are familiar with the intense chest pain associated with heart issues, discomfort in areas like the jaw, throat, or neck isn't commonly recognized as a warning sign. Consequently, it's easy to dismiss such symptoms as minor or unrelated, without realizing they might signal a serious problem with the heart. Pain related to heart conditions may appear in unexpected places, including the jaw, neck, or even the teeth. This occurs because the heart lacks pain receptors like those found in the skin or muscles. Instead, when the heart is under stress, such as when it isn't receiving enough blood, it sends signals via the vagus nerve. This nerve runs from the brain through the chest and into various parts of the upper body, sometimes causing the brain to interpret heart pain as coming from the jaw or neck. Adding to the challenge, this type of pain can be intermittent. One day, you might notice a mild ache in your jaw. Another day, there could be stiffness in your neck. The discomfort may even dissipate temporarily, only to reappear during stress or physical exertion. This on and off pattern makes it easy to dismiss until the situation becomes critical. So how can you recognize if jaw or neck pain might be a warning sign of heart trouble? Pay attention if the pain comes on suddenly, feels unusual, or is accompanied by other symptoms such as difficulty breathing, nausea, dizziness, or fatigue. Additionally, if the discomfort worsens with activity but eases during rest, this could indicate angina, a condition that suggests the heart isn't receiving sufficient blood. Don't ignore these signs, they could be your body's way of alerting you to a serious issue. 6. Dizziness or lightheadedness. As you go about your day, you suddenly feel the world shift, a wave of dizziness sweeps over you, leaving you momentarily unsteady. You brush it off, assuming it might be dehydration or that you stood up too quickly. But then it happens again. This time, you feel lightheaded, almost as if you might pass out. The sensation lasts only a few seconds before fading, and you move on. Yet, what if these fleeting spells of dizziness are not as harmless as they seem? A sudden feeling of faintness or instability can be one of the early signals that your heart may be struggling. It's crucial to take such sensations seriously, as they might be your body's way of alerting you to an underlying issue. Your heart's critical role is pumping oxygen-rich blood to the entire body, including your brain. If this flow is disrupted, due to narrowed blood vessels or a heart-related problem, your brain may not receive enough oxygen, potentially leading to dizziness or faintness, even without exertion. Some people describe this feeling as a wave of weakness, as though their body is ready to give up, while others report an odd floating sensation, almost as if the ground underneath them is shifting. Unlike dizziness caused by dehydration or rapid posture changes, heart-related dizziness often strikes unexpectedly. It doesn't follow a predictable pattern and can occur whether you're seated, standing, or lying down. So how can you tell when dizziness warrants concern? If you experience recurring episodes of lightheadedness without any obvious trigger, especially if they are accompanied by other symptoms like fatigue, shortness of breath, or chest discomfort, it's important not to ignore them. These could be warning signs from your body, urging you to take action before a potentially life-threatening heart issue develops. Listening to your body and seeking medical advice promptly could make all the difference in protecting your heart health. 7. Pain in the upper back or shoulders. You stretch your shoulders, attempting to shake off the dull ache spreading across your upper back. Maybe you slept in an awkward position, or perhaps you've been sitting for too long. You roll your shoulders, hoping the discomfort will ease, but it persists. Instead of subsiding, it lingers, creeping into your shoulder blades and, at times, radiating down your arms. While it's not unbearable, it is certainly annoying. Pain in the upper back or shoulders can sometimes be an early and often overlooked warning sign of a cardiac event. Unlike the sharp, stabbing pain caused by an injury, heart-related discomfort tends to manifest as a deep, spreading pressure or tightness. This occurs because the nerves transmitting pain signals from the heart don't always direct them to the chest. Instead, these signals can radiate to other areas such as the back, shoulders, neck, or even arms. Certain groups of people are more likely to experience upper back pain as a potential indicator of a heart issue. Women, diabetics, and older adults are especially prone to feeling discomfort in areas beyond the chest. Additionally, individuals with high blood pressure, elevated cholesterol levels, or a history of smoking are at greater risk. If you fall into any of these categories and notice unexpected or unexplained pain in your back or shoulders, it's important not to dismiss it. Taking precautionary action and consulting with a doctor can provide clarity and peace of mind. It's always better to be safe than sorry. 8. Mild chest discomfort that comes and goes. Intermittent chest discomfort ranks among the most dangerous yet frequently overlooked warning signs of a potential heart attack. The key aspect here is the word intermittent. It doesn't always feel intense, nor does it persist, rather, it comes and goes, often leading people to dismiss it as insignificant. However, what's occurring inside the body is far more alarming. When blood flow to the heart becomes restricted, the heart temporarily receives insufficient oxygen. This makes it harder for the heart to function properly. This condition, known as angina, causes discomfort, not necessarily pain, but a sensation of tightness, pressure, or heaviness in the chest. Unlike a heart attack, angina is temporary. The discomfort might last a few minutes and then subside once the heart gets adequate oxygen again. Because of this brief nature, many tend to ignore it. Here's why that's dangerous: angina is not a harmless symptom. It's a direct warning signal of an impending heart attack. Initially, you may notice this discomfort only during physical activities, climbing stairs, carrying groceries, or feeling stressed. It fades with rest, which makes it easy to dismiss. However, as the arteries become increasingly clogged over time, this discomfort starts to arise with less effort and eventually may occur even while you're at rest. When that moment arrives, you could be hours or even minutes away from your heart reaching its limit. Another reason this symptom is so dangerous is that it doesn't always present as classic chest pain. It's often described differently among individuals: tightness in the chest, like a band squeezing around it, a sensation of heaviness, as though something is pressing down, a burning feeling mistaken for heartburn, a fullness resembling bloating, or discomfort that isn't confined to the chest alone. It can radiate to other areas such as the arms, shoulders, neck, jaw, or even the upper back. If this discomfort becomes more frequent, lasts longer than usual, or appears alongside other symptoms like dizziness, nausea, cold sweats, or shortness of breath, don't ignore it. Waiting until the pain becomes severe and constant may mean you're already experiencing a full-scale heart attack. Acting quickly can make all the difference. Appropriate avoidance measures. A heart attack doesn't happen out of nowhere, it's the result of years of silent damage. The good news is that you have the power to prevent it. Every choice you make today impacts your heart's health tomorrow. Your diet plays a crucial role, it's either fueling disease or fighting it. Avoid processed foods, trans fats, and excess sugar. Instead, focus on nourishing your body with whole foods, vegetables, lean proteins, and heart-healthy fats like olive oil and fish. Every meal is an opportunity to protect your arteries. Exercise is about more than fitness, it's essential for survival. Your heart is a muscle, and without regular movement, it weakens. Even a 30-minute brisk walk each day can significantly reduce your risk of heart disease. If you've been sitting too much, it's time to break the habit and get moving. Stress is another silent killer. Chronic stress raises blood pressure, tightens arteries, and increases inflammation in the body. Managing stress is critical for your heart's health. Incorporate activities like meditation, deep breathing, or simply setting boundaries in your daily routine. Your heart craves peace just as much as it needs oxygen. Smoking and excessive drinking wreak havoc on your heart from the inside out. If you smoke, quit as soon as possible. Every cigarette damages your arteries. As for alcohol, moderation is key. Overconsumption adds up faster than you might realize. Conditions like high blood pressure, high cholesterol, and diabetes must be kept in check. Regular checkups are essential because if you don't monitor these factors, you can't manage them effectively. Remember, your heart's fate isn't predetermined, it's shaped by the choices you make every day. Start taking action now because your future truly depends on it. If you found this message helpful, don't forget to like this post, it helps us provide more valuable content for you. Share your thoughts, questions, or ideas for future topics in the comments below, we love hearing from you. And of course, hit the subscribe button and turn on notifications so you never miss out on our latest health tips and insights. Stay informed, stay healthy, and we'll see you in the next update.